If you're over 60, what I'm about to share may shock you. After speaking with hundreds of healthcare workers, I've uncovered a disturbing truth about how doctors really view older patients. These 5 harsh realities are costing seniors proper care, respect, and in some cases, years of life. One retired physician even called it the healthcare industry's worst-kept secret. Don't let another appointment pass without knowing what happens behind closed doors. This knowledge could save your life. Welcome to Life Advice for Older People. What you're about to learn could permanently change the way you approach healthcare. Today, I'm exposing 5 brutal truths about medical ageism that the healthcare system doesn't want seniors to know. Here's the roadmap. The mental shortcuts doctors take the moment they see your age. The economic calculations shaping your treatment. The stereotypes filtering how your symptoms are interpreted. Prescription practices that specifically target. But here's the good news. I'll also share the exact strategies successful seniors use to flip these dynamics and command top-quality care. If you've ever felt dismissed, rushed, or talked down to by medical professionals, this video will give you the tools to make sure it never happens again. Hit that like button if you're ready for the truth, and subscribe with notifications on. This information could literally save your life. Comment below with your biggest healthcare frustration. Let's begin. Truth 1. Doctors label you as expensive and complicated before you even speak. The moment you enter a medical office, your age triggers a calculation in your doctor's mind. Seniors are automatically placed into the high-maintenance category. This isn't personal, it's how the system trains doctors to think. Dr. Sarah Henderson, a former ER physician who now advocates for seniors, revealed that medical schools teach efficiency protocols that sort patients by age. Older patients are assumed to require more time, tests, and medications. This creates unconscious bias before the exam even begins. Financial pressure makes it worse. Declining insurance reimbursements and rising patient quotas mean doctors feel economic strain. Your needs often clash with their limited time, creating resentment that affects care. Studies even show doctors spend about 23% less time listening to patients over 65, compared to younger ones with the same symptoms. Take Maxine, a 74-year-old retired librarian. She carefully tracked her symptoms for weeks, but when she tried to explain them, her doctor cut her off, saying, "Let's focus on your main concern today." Her chest pain was brushed aside as anxiety, delaying a cardiac diagnosis by 6 months. Doctors often avoid thorough tests for seniors, fearing complex results will require more time and resources. The psychological impact is huge. Instead of working with you on a tailored plan, they stick to generic senior care protocols. How to fight this bias? Start appointments with clear, measurable goals. Instead of, "I feel tired," say, "My energy dropped 40% over 3 months, and I want to know why." Bring a 1-page health summary showing past improvements to prove you're an engaged patient. Request follow-up appointments for deeper concerns, showing respect for their schedule while advocating for proper care. Take notes during visits. Accountability changes behavior. Truth 2. Doctors dismiss your symptoms as just aging. Medical gaslighting against seniors is so common that many providers don't realize they're doing it. Legitimate symptoms are written off as normal aging, delaying diagnosis. Dr. Michael Torres, a geriatrician, calls the phrase, "you're getting older," a medical cop-out. Research backs this up. 85% of serious conditions in seniors are first dismissed as aging before proper diagnosis. Heart disease becomes fatigue. Thyroid issues become normal slowdown. Depression is framed as adjusting to aging, and even cancer symptoms get brushed off as wear and tear. Carl, a 67-year-old former construction supervisor, complained of worsening stiffness and fatigue for 8 months. His doctor kept saying, "You're not 30 anymore." Only after demanding tests was he diagnosed with severe rheumatoid arthritis, which had already caused permanent joint damage. Doctors often use stock phrases like, "That's expected at your age," to avoid deeper investigation. Women face double dismissal due to both age and hormones, while men's concerns about sexual or emotional health are brushed aside as male aging. Mental health is especially neglected. The worst part? Seniors begin doubting their own experiences, delaying care even further. How to fight this gaslighting? When told something is normal for your age, ask, "What percentage of people my age experience this?" Or, "What studies back that up?" Track timelines. My energy was stable until March 15th, when I started meeting daily naps. This reframes it as acute, not aging. Ask, what tests would you order if I were 40 with these symptoms? Bring an advocate to appointments to hold doctors accountable. Truth 3. Doctors assume mental decline and oversimplify your care. One of the most damaging biases is the assumption that seniors can't handle complex information. Doctors simplify explanations, skip advanced therapies, and avoid technical details, even when patients are capable. Dr. Amanda Richardson, a neurocytologist, says providers consistently underestimate seniors' cognitive abilities. This leads to less effective treatments, skipped diagnostic options, and poor outcomes. Louise, a 71-year-old retired chemistry professor, was diagnosed with early-stage breast cancer. Her oncologist recommended a simple mastectomy without discussing reconstruction, therapies, or trials. His reasoning, at your age, we want to keep things straightforward. She had to fight for equal treatment. This prejudice shows up in oversimplified language, skipping details, and assuming seniors can't use technology like health apps or portals. The result is dependency that didn't exist before. How to fight this bias? State your background up front. I managed complex projects for 30 years. Please give me the detailed information. Ask for explanations using medical terms. Can you explain the pathophysiology of my condition? Bring research, notes, or articles to show engagement. Use technology during appointments to prove competence. Request written treatment plans to review thoroughly. Truth 4. Medications are often used for control, not treatment. This is one of the darkest truths. Drugs are sometimes prescribed not for health, but to make seniors easier to manage. Dr. James Martinez, a former nursing home medical director, said he saw anxious patients given sedatives, assertive ones given mood stabilizers, and questioning patients given antidepressants. It's chemical restraint disguised as care. The numbers are staggering. Over 40% of seniors are prescribed psychiatric drugs, yet only 12% have diagnosed mental health conditions requiring them. These drugs often cause falls, confusion, and even higher mortality. Beverly, a 69-year-old former school principal, became frustrated during rehab after hip surgery. Labeled difficult, she was given anxiety meds. They caused confusion and balance issues, leading to a fall and broken wrist, adding 4 months to her recovery. This practice extends to sleep aids, pain meds, and blood pressure prescriptions, often worsening the very issues they're supposed to treat. How to protect yourself? Ask, what specific condition is this medication for? How will we measure its effectiveness? Avoid vague prescriptions like, for agitation, without a diagnosis. Demand treatment goals and timelines. Request independent medication reviews. Document your cognitive and physical state before starting psychiatric drugs. Build a support network to advocate for you if side effects impair judgment. Truth 5. Doctors weigh your life value against treatment costs. Behind closed doors, doctors use formulas that assign different value to lives based on age. Quality-adjusted life years essentially rate a 70-year-old's years as less valuable than a 40-year-old's. Dr. Patricia Chen, an ethics professor, calls this systematic discrimination disguised as economics. Seniors are denied surgeries, advanced therapies, and screenings, not because they wouldn't work, but because of cost-benefit calculations. Walter, a 68-year-old retired engineer with kidney failure, was pushed toward palliative care instead of dialysis. After fighting for access, he lived 7 more productive years. Insurance companies and hospitals reinforce these practices, denying expensive diagnostics and preventive screenings for older adults. Mental health care suffers too, with depression and anxiety dismissed as normal aging. Over time, seniors start believing their lives are less valuable, accepting substandard care without protest. How to fight this bias? Ask directly, would you recommend the same treatment if I were 45? If not, why? Bring research on outcomes for your age group. Get second opinions from geriatric specialists. Document discrimination and connect with advocacy groups. Remember, you have the right to refuse age-appropriate limitations. Now you know the 5 ugly truths about medical ageism. But here's the turning point. Knowledge is power. With these strategies, you can transform from a passive patient into an empowered advocate. Think of Walter, who fought for dialysis and gained 7 years. or Beverly, who recovered despite medication setbacks. These aren't rare cases. They're proof of what happens when seniors refuse age-based discrimination. Every time you challenge bias or demand equal treatment, you're not just protecting yourself, you're reshaping the system for others. Your health, dignity, and years are too valuable to surrender to prejudice. You deserve care based on your health profile, not your birth date. If this exposed something you've experienced, hit that like button and share this video. Your story might save another senior's life. Comment below if you've faced medical ageism and what you'll do differently at your next appointment. Subscribe and hit the notification bell because every senior deserves respect, dignity, and life-saving care. Together, we can change healthcare for the better.